You just turned 65, or you're helping a parent figure out their Medicare options. There's a decision in front of you that most people make without fully understanding what they're choosing. And because it affects your healthcare costs every single year for the rest of your life, getting it wrong compounds. Today, we explain Medicare Advantage and Medigap in plain English, put the real numbers on the table, and help you figure out which path actually makes sense for your situation. Quick note, Medicare is a U.S. government program. Everything in this episode applies specifically to the United States. This is Policywise, insurance explained honestly.
The trade-off. Medigap plans have monthly premiums, and those premiums are meaningfully higher than Medicare Advantage plans, often $100 to $300 or more per month, depending on your age, location, and the plan type. And Medigap typically doesn't include dental, vision, hearing, or drug coverage. You'd buy a separate Part D drug plan. The key features of Medigap that make it different from Advantage. You can see any doctor who accepts Medicare, anywhere in the country, no networks, no referrals, and your cost predictability is very high. Let's put rough numbers on it. These are illustrative figures. Actual costs vary significantly by location, insurer, and plan. Scenario 1. Healthy year, minimal care. On a Medicare Advantage plan with low or zero premium, you might pay close to nothing out of pocket beyond your Part B premium. On Medigap, you'd pay your monthly supplement premium, say roughly $150 to $200 a month, even in a year where you barely used healthcare. In a healthy year, Advantage wins. Scenario 2. Moderate care. Some specialist visits, a minor procedure. Advantage plans have co-pays for each service. These can add up across a year. Medigap, once you've met the Part B deductible, covers the rest. The gap between them narrows. Scenario 3. Serious illness, hospitalization, extensive care. Advantage has an out-of-pocket maximum, which provides a ceiling, but can be several $1,000s. With Medigap Plan G, after the Part B deductible, your costs for covered services are essentially zero. Medigap wins significantly in catastrophic scenarios. The bottom line, Medigap has higher guaranteed monthly costs, but predictable low out-of-pocket costs. Advantage has lower monthly premiums, but variable costs that can be higher if you need significant care. Here's the part that most people find out too late. Medigap has enrollment timing rules that can permanently affect your options. When you first enroll in Medicare Part B, at 65 or whenever you activate it, there's a Medigap open enrollment period, typically 6 months. During this window, insurers cannot deny you a Medigap policy or charge you more due to pre-existing conditions. It's guaranteed issue. After that window closes, insurers in most U.S. states can use medical underwriting. They can deny your application or charge higher rates based on your health history. Some states have stronger consumer protections, but many do not. Here's the trap. People enroll in Medicare Advantage because the premiums are lower. Then years later, they get sick and want to switch to Medigap for better coverage. They try and find they can't qualify medically, or the premiums are very high because of their health status. Choosing Medicare Advantage isn't irreversible for everyone, but the pathway back to Medigap with guaranteed issue rates is often closed after that initial enrollment window. This is why the decision at 65 carries long-term consequences that aren't obvious on day one. If you're turning 65 soon, your Medigap open enrollment window is one of the most important insurance windows in your life. Understand it before it passes. If you're helping a parent navigate Medicare, ask them which option they chose and when. If they're in Advantage and healthy now, understand what their options would be if they needed to switch. If you're under 65, this episode is for future you or for a parent you'll be advising. Save it.
If you're in a rural area or travel frequently, Medigap's any doctor, any state coverage can be significantly more valuable than in urban areas with dense Advantage networks. Medicare Advantage. Lower monthly premiums, often bundled extras like dental and vision, network restrictions, variable out-of-pocket costs with a cap. Medigap. Higher monthly premiums, predictable near-zero out-of-pocket costs for covered services. See any Medicare-accepting doctor. No network. The critical wild card. Medigap guaranteed issue rights are strongest during your initial enrollment window. Switching to Medigap later may be difficult or expensive depending on your health and state. Next episode, 5 Medicare mistakes that cost people significant money, including one that's described as almost impossible to undo. If you or someone you love is approaching Medicare age, this is the episode to send them. That's coming up next. Subscribe for one honest insurance breakdown every week. This is Policywise.
General education only, not financial or medical advice. Medicare rules are U.S.-specific and change periodically. Work with a licensed Medicare specialist or your state health insurance assistance program before making enrollment decisions.